Hi, I'm Dr. Deanna Colliker. I'm the Director of the Emergency Department at Telluride Medical Center. And I'm going to talk to you today about stroke, or sometimes what we refer to as a brain attack. You know, everybody knows to take chest pain and symptoms of a heart attack seriously, but sometimes people tend to ignore the symptoms of a stroke, which really has the same implications. Time is tissue. What a stroke is any alteration in blood flow that causes damage to the brain. And there are two different types of strokes. You can have an ischemic stroke, or where blood flow is blocked from getting to the brain tissue, like with a blood clot. Or you can have a hemorrhagic stroke, or a bleeding type stroke, where a blood vessel bursts, and that causes damage to the brain tissue. Both of these instances are emergencies and need treated immediately. Some of the things that we tell people are the symptoms that they can recognize that perhaps they or their loved one are having a stroke are if you have sudden numbness or weakness in your face or your arms or leg, if you have sudden confusion or trouble speaking, if you have trouble walking, dizziness, difficulty with coordination, or if you have a sudden severe headache that is worse than any other headache you've had in your life. Those are all symptoms, or can be symptoms, of a stroke. We also use a simple mnemonic called FAST, F-A-S-T, and those stand for warning signs that if you or somebody that you know are exhibiting symptoms, they may be having a stroke. F stands for face. So you ask the person to smile, and if they have one side of their face drooping, that would be something to be worried about. A stands for arms, and you have them put their arms out in front of them, and if one arm droops, that could be a warning sign. S stands for speech. So if there's any abnormality in how speech is delivered, so if words sound funny, or if there's confusion or somebody can't find the words, that would be a warning sign. And T is for time, because time is of the essence. So if any of these things are occurring, you need to call 911 immediately. The other thing that is important is to try and remember the onset of the symptoms, because the time that has gone by really affects our treatment options. For instance, if you have a stroke that is caused by a blood clot, we can give a blood clot busting medication if we're in a certain period of time, such as 4.5 hours. That's our treatment window. And so once again, time is of the essence. So use the mnemonic FAST, F for face, A for arms, S for speech, and T for time. And if you have any symptoms of a stroke, please call 911. If you want further information, you can click the link below, or you can go to www.stroke.org. I'm Deanna Colliker. Thanks for tuning in.